support our coverage with a free account on Privacy, the service that keeps you protected when shopping online. Get $5 to try it now by using promo code QZZ2J.
Oh, okay. I think
Hello.
Hey, welcome to our coverage. Please, so you've got a shirt on that says HITS.
Yes.
So tell me about HITS and what you're doing here at CES.
Yes. Hello, everyone. I'm from HITS, and first of all, my name is Sang-Yeon Hwang. I'm an AI scientist in HITS, and HITS is an AI drug discovery startup based in Korea.
It's a drug discovery?
Yeah. If you are confused, you can understand it as a medicine discovery.
Oh, okay.
Yeah,
All
sure.
right.
Yeah. So yeah, we are we are developing and serving AI models which predicts the right compounds when you are to discover the new medicines.
Oh.
So yeah, I'm as an AI scientist, I developed the AI models which is necessary in the whole drug discovery processes.
You know, drugs are evolving very, very quickly now. And so I find this curious that you're using AI to essentially come up with new compounds. What does the science take to, first of all, just to program that, to get that AI, the ability to do that type of, to do that type of discovery? What kind of inputs does it need?
You mean the input is required by our product?
Yeah.
Yeah. Basically, we are at CES. We are introducing our first SaaS product named One Platform.
Okay.
It's a web-based platform, and the input requires the two things. The first thing is the protein structure that you want to target. So to treat most of the disease, you basically need to target the protein's dynamics.
Okay.
And the controlling the protein dynamics is done by some small compounds, chemical compounds.
Right.
So what you need to do is to discover the right chemical compound, which eventually becomes a drug or medicine.
Right.
Yeah. So the first input I said was the protein structure, and the second input is the chemical structure that you are interested in. And if you give those two inputs, then our AI model predicts how much effective your compound is corresponding to those protein structures.
Those particular protein structures.
Yeah, yes.
Because you probably have some history already knowing from previous drugs what happens with the use of certain chemical compounds against certain proteins. So there's a little bit of a knowledge base there already.
Yes.
So do you expect this then to be sold to pharmas, or who do you think your users are going to be? Do you think it's going to be the pharmaceutical companies?
That's a very good question. Your main target is the researchers in the pharmaceutical companies, or in a broader sense, pharmaceutical community.
Right.
And we hope that using our one platform, let me show you in shortly. It is just one screen of our product. I don't know if the screen can be seen.
If you put it here. Yeah.
Yeah. And this is just our leaflet.
Let me hit cancel. It's trying to connect to the Wi-Fi.
Oh, yeah. You don't have to connect, I think. Maybe.
Yeah, there we go.
Yeah. Basically, it is one of our screens, or one of our screen of the product. It shows the results of our AI prediction, which predicts the binding structures between your compound and the protein. So using this kind of results, the researchers can, by themselves, using the AI models, they can predict the results of their experiments before doing it in reality.
Wow.
So that they can reduce the time and the monetary cost.
Right.
That is our hope. Yeah. So in short, the main market is the researchers.
The researchers.
The pharmaceutical community.
So because the process is very expensive. At least here in the United States, I don't know how it is in South Korea, but I know here that they have to have the drug compound review. They have to test usually on mice or different, and then it maybe progresses to human test, and it's very expensive and takes a long time.
Very, very well, I think.
Well, this is something that's pretty well known. I think most people understand it could take 10 years maybe for something.
Exactly. Actually, what we repeat in this CES is that to discover one medicine, on average, it takes about 10 to 15 years.
Yeah.
And it costs about $3 billion.
So do you think then, what do you predict that this is going to shorten, because they're going to have to run multiple scenarios.
Exactly.
So do you think this is going to allow them to cut their research time by 1 year, 2 years? What is the cost? What is the time? Because that's what they're going to say is how much time is this going to save?
Of course, what we are mostly focusing on is somewhat relatively earlier part of the whole drug discovery process. In the earlier part, our purpose is to discover some candidate compound which deserve to enter into some preclinical and clinical or something.
Right.
So, and those part takes about it can take as long as 10 years alone.
Right.
But during our past projects with other major pharmaceutical companies in Korea, we confirmed that we can reduce that period by less than a quarter.
Wow.
Yeah, and so we believe that, so we confirmed our model's accuracy by the co-work, and then in this one platform, we are now we've implemented those models into a web platform so that the researchers by themselves can record the predictions easily.
So you're a pretty smart guy. So HITS do you have a team that helped you build this, or are you a startup? Did you get funding? How did you fund this whole project?
Oh, we've actually in the early last year we've finished our Series A funding.
Okay.
And well, based on funding, and we have an AI research team, and
Okay.
together with the team colleagues, we develop the models required in the drug discovery processes.
So do you have a biology background as well, or just purely the AI side?
My major was chemistry,
Okay.
technically the computational chemistry.
Yeah.
So that was also a good question because the scientists in the AI research team mostly know well about AI only, but this domain requires much larger knowledge related to biology and biochemistry or something.
Right.
So, and we have other team who specialize in those parts, conventional drug discovery
Right.
process. So we co-work with them.
Do you think that this model, this AI model, obviously you want a feedback loop?
Yes. We need to keep elevate the accuracy of the models.
Right. Because let's say we're 5 years down the road and they do some trial and the protein response was not what you expected, then you got to adjust the model. But don't you think, though, once the model starts getting adjusted based upon real world stuff, that it's going to be, at some point, this is going to get really, really accurate? I would think so. As you put the adjustments to the model, I would think that over time it's going to get a lot better. The accuracy of the prediction is going to get better, the AI model.
Of course, that is our hope and expectation because it is basically data science. So the data matters.
Right.
So the data is maybe all what you need to develop an accurate model. But the reality is that this data requires the experiments.
That's true.
So we don't have enough data always.
Yeah.
So I think data is not all you need. So you need to design very well your model and architecture and the theory within it. So of course in the future more data will be compiled, but there will be new diseases whose data is not available.
And you also have to run, at some point you have to time this model the possible risk of side effects, don't you?
Yes.
Yeah, because that's the big thing. You know, when a new drug comes out, it's got a list this long of you know, be careful if you're sweating, or, you know, it's got all the...
I understand.
Yeah.
I understand.
So I would think, too, that if you know the side effects, then that helps the model as well, saying, okay, probably on this particular job, some people are going to have trouble with this, and that as potential side effect. This is very fascinating.
Yes, I agree. I think that's related to something called multimodal uh, data. Like where to my understanding, what you said is that to accurately predict the efficacy of one drug, maybe incorporating some side effect information will help. Well, maybe it is possible, but I don't think the data related to that side effects or something is large. So I don't know if that is large.
Don't even know if it exists.
Yes,
Yeah.
and it won't be very easy or straightforward to incorporate other other categorical information into the prediction.
Right. It's amazing where we're at. Pretty soon we're going to live to be 200 years old.
So maybe, but I don't know that is positive thing.
I know.
I'm not sure about
maybe,
that.
It may be true. All right. Hey, thank you so much. Where can people find more information? Where's your website at?
Our website is we are currently demonstrating using just the demonstration site.
Okay.
And our company's official website is hits.ai.
Hits.ai.
You can visit to see more information of our company.
Outstanding. Congratulations.
Thank you so much.
Thanks for stopping by.